Okay, we're getting started with our skinny BBL today. So this is a patient, as you can see, not a overweight patient, but she's unhappy with her hip dips right here. So we're going to be taking fat from her abdomen, her inner thighs, her back, and between all those areas there's enough fat to help give her a little more projection in her buttocks, but also really fill in those hip dips, which is her primary concern. So let's go ahead and get started. So we're starting out with just tumescent solution to the abdomen and inner thighs. That's where we're going to get the fat from. But we want to do the front first because we need this fat for the back, because just getting the back fat alone won't be enough for the BBL to fill in the hip dip. So just the tumescent, that just helps constrict the blood vessels, minimize bleeding, so we get nice pure fat out. Doing the liposuction now, we're working on the flanks. I'm using this curved or angled cannula to really get around the flanks, to help cinch in her waist. Getting some good fat here. Let's see here, some good fat right there. And then I'll also do the inner thighs and the back, and with all that we should have more than enough fat. Okay, now we're going to the back. We've already put in the tumescent solution. We like to let that sit for about 10 minutes. So while we're letting that sit, I want to explain something to y'all. That we've done the tumescent solution here through this incision here, one here and one here. And the reason we placed those incisions specifically there is because the patient, I asked her to bring in her bikini bottoms, or she brought in a G-string, so that we can mark where the G-string would be, and so we can make sure the incisions were hidden underneath there. So not only can we find fat from anywhere on even a thin person, we can put the incisions wherever you want it, so that you can go out on the beach or whatever and nobody will be able to see your liposuction incisions. So looking at this G-string, these photos, we actually have marked out where her incisions are. So the markings are there, you just can't see it because we've surgically placed them to be hidden by the G-string. So obviously if she changed her underwear, you might be able to see the incisions, but at least in this outfit, which she brought, this will be well hidden. So we're doing some liposuction now finally on the back, and you can really see how snatched in her waist is. So her buttocks look bigger by comparison. It looks really nice. And then after we do the liposuction, we'll purify the fat, we'll inject into the buttocks. But her main goal here is injecting into the hip dips. So she was very clear with me, she does not want a huge butt. We'll still put a little bit of fat in there, but her main goal is to really give her that upside down heart shape by putting fat in the hip dips, which is, by the way, a totally normal anatomical depression. That doesn't mean there's anything wrong with her, but just people want more of that rounded shape now. So just showing you, we've really scooped out her waist. She looks great there. Now we're going to start to do fat injections through this incision here to really focus on the hip dips. We will put some in the buttocks, but the patient was very clear that she wanted to have more fat in the hip dips, and so we're going to go ahead and start injecting that fat now. We put in 800 cc's so far, filled in the hip dips. It's all bumpy and stuff, so I'm going to do my signature move now and massage that. It's a little flat right here. We're going to break up some fibers, help round it out, and even if this doesn't round it out enough, we can use the pickle fork. I can hear some fibers popping. All right, looks better. Actually does look better. So might do a pickle fork in a couple places, but looking really good. I feel like this area right here is a little flat, so I'm going to take the pickle fork, go on through this incision right on top of the sacrum. There it goes. I'm just going to break up some fibers right there. There you can always see it coming out, rounding out. It's amazing how fast that works. You don't want to overdo it because that can create a seroma, which is like a fluid collection underneath the skin. Looks great. Wow.